Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. Indeed it is. We are coming at you live from the Scottsdale Airpark Money Radio Studios here in the month of May 16. We're like halfway through the month of May and almost through the first half of 2025. Go figure. It goes by so fast. So we're coming at you live from the Scottsdale Airpark Money Radio Studios. You can catch us podcasting too. We've been doing that for over a year now, so please go out to any of your podcasting apps, pull us down. Please like us, review us, and recommend us. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. They do that by listening here, not to me, but to these extraordinary guests that I get to come to the show. And today's no different. I got an extraordinary guest. It's been 3 years, Dave. I cannot believe it. Dave Voepel's in the house.
Unbelievable.
He is the CEO.
Time does fly.
It does. It does. He's the CEO at Arizona Healthcare Association.
Yes.
That's
Arizona Healthcare Association.
Yeah. So what is Arizona Healthcare Association?
You would think that we sell health insurance or something, wouldn't you?
Well, yes.
Healthcare Association.
Who named that in the first place?
Because it goes back to the 50s.
It does.
It does. Yeah. It goes back to the 50s. And we were following the national group, the American Healthcare Association. So, and it happened in all 50 states, so there's a healthcare association in the majority of them.
Right.
Some got creative and decided they wanted to be healthcare facilities, that type of thing in their name. But we represent skilled nursing facilities, and assisted living centers throughout the state.
Wow.
Yeah.
That's big.
It is.
How many are we talking about?
So in Arizona, we have 142 licensed skilled nursing facilities, and you might hear me refer to them as SNFs. That's not me sneezing or anything like that. It's just the acronym.
We're full of acronyms.
We are.
142.
Yep. 142. Which
that doesn't sound like it's enough.
It's not many, is it?
No.
But
for what, 6.8 million people that live here?
Yes.
Yeah, 142?
But we have a lot of assisted living communities out there. So we have 1,850 group homes, 10 bed or less, and then we have 350-ish centers, which are 11 bed or more. We operate or advocate for the skilled nursing and the center side of things from the assisted living piece.
So about 2,500.
So
2,600, right? Just round point.
Yeah, round numbers.
And,
sure.
and I'm competitive. I know you are too.
Mm-hmm.
So how does that compare to other states? I mean, we're
small.
I was going to say, well, we're a big state, but we don't have as many places for people to go.
And you have to remember that when Medicaid first came into the whole business of taking care of people, the impoverished especially, that was the partnership between the states and the feds, where the state gets 50%, the fed gets 50%, but they started out east, and Arizona was the last state, not until the 1980s, to sign on to Medicaid. They wouldn't have anything to do with it because this is the Wild West, and we're free and we're independent, and we're staying away from that government stuff. So,
yeah, it's kind of like what happened with the Department of Transportation.
Exactly.
Because we weren't going to go to 55 miles an hour.
That's right.
Basically our state just gave the federal government the finger and said, no, we're going to keep it where it is. And we weren't building highways.
Yeah, leave us alone.
We got a little behind.
Yeah, exactly. So We didn't get started in the what we refer to as the Altex space, which is Arizona long-term care space on Medicaid, until the late 80s, something like that. And then really not until the 90s. But the way it was structured here in Arizona, we are under an 1115 waiver, which means nothing to anybody except that's the chapter, verse, whatever you want to call it, of the federal regulation. And we're one of the few states fit into that waiver, which means that we are a home and community-based state, which for everybody out there means that your option, they will pay you to mainly stay at home.
Right.
So they want you to go to the best setting that you want to go to, but let's start with home first.
And that's what we
It's
do.
unique.
And we provide in-home supportive
Exactly.
care services. But the biggest challenge we run into, and it's the same challenge you're running into, budget.
Correct.
And, we're nowhere close to sin die in the legislature right now. And we're way past 100 days. We're probably about 120 days right now. And it's
Often, every time I hear the 100 days, I want to go back and research. When was the last time they made the 100-day mark?
I don't think not in our lifetime.
Not in our lifetime.
It's been a long time.
It's been a while.
And especially as contentious as it is there. And,
For sure.
and before we go down the advocacy lane, because I do want to talk to you about some of the advocacy work that you do, and that's the extraordinary work that the Arizona Healthcare Association does. You're advocating for, obviously, your members that are part of you, but you're also advocating for the vulnerable and older adults that are out there.
Right, for sure.
And I mentioned, the HCBS waiver, and I mentioned, the need to have them at home and the costs. But I really would like to really be able to talk about the work that you do and the Arizona Healthcare Association. So advocacy's one, but what else are you doing on behalf of the membership that you have?
So I always tie it back to the members. So folks like you, folks that we have in our association that do the work of the people. I mean, they do the work of angels.
Mm-hmm.
I know I couldn't do what they do, and so that's why I'm happy to be advocating for them, to do whatever I can do to help, and whatever the association can do to help, to try and either bring more light to what's going on,
Mm-hmm.
to solve problems in a collaborative way, or to bring more reimbursement and dollars into the system so that you have more choice and so that you have other places to go and so that there are great providers that stay in the program. Otherwise, without that, you have a lot of people that will be missing a good home.
Right.
And that's a huge struggle. So part of our job is, sure, we're here to advocate for facilities and for assisted living communities. Okay, that's fine. But what does that really mean? And you got to really dig down deep and look at the residents that they serve, and the CNAs and the caregivers that serve them, and then the administrators, the RNs, the LPNs, because it takes, in the immortal words of Hillary Clinton, it takes a village.
Yeah.
So,
Can't believe you referenced her.
I can't either.
Where did that come from, Dave?
I don't know. We can erase that, right? We can go back and
We'll talk
take
to
that out.
We'll talk to James to see what he can do. But
Yeah, I can't believe I did either.
No, but I get what you're saying, and it really does take all of us, and it really takes, rising tides lifting all boats, because,
There you go. You got a Ronald Reaganism in there.
Thank you.
I should have nailed that one first instead of going the other way. It's like,
I got some other good
nice.
Ronnies. Yeah,
Nice.
he was classic.
He was classic.
He definitely,
I love that guy.
He definitely was. But when you sit down and you think about it, I mean, my dad said this to me, and I would imagine your parents said the same thing. Do not put me in a nursing home.
Right.
Because that's not where I want to go. But we've come a long way.
Oh,
I mean, the nursing homes from the 50s and 60s that my father knew, and even the ones you and I knew from the 70s and 80s,
right.
are very different today.
Very different. It's not your father's Oldsmobile. How's that?
Who quoted that?
Yeah.
That was the commercial.
That was the commercial. Yeah, that was the Oldsmobile commercial from the 80s. Yeah.
Might have been James Earl Jones or someone like that, the voiceover.
Exactly. My dad and mom were old enough that they were born and raised through the Depression. My dad was a World War II vet.
Wow.
So they didn't know what nursing homes were. They were functionally group homes back then.
Wow. And to think about 1985 when my mother suffered a heart attack,
Yep.
there was no such thing as assisted living.
Correct.
Or in-home supportive care services.
My grandmother, who died at 98 back in 1995 or 90, She was in an assisted living, but they didn't call it that. They called it a friend home.
A friend home.
Yeah, it was a 3-story. They had an infirmary. They had a cafeteria. And she gave them all of her Social Security except for $50 a day.
I think James wants us to end our first segment. So
that's why the music.
That's why the music.
Start singing.
So we got 3 more to go. We're down 1. Stick around. We got Dave Voepel in the house. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our second segment here. And I've got in the studio with me, I've got Dave Voepel. And it's really a pleasure to have Dave back here in the studio. He's the CEO of Arizona Healthcare Association. And if you missed our first segment, it was a good one.
Yeah.
Do you think we can pull off another 3?
I don't know.
We got to fake it till you make it.
That's right.
So we got 3 more tries at it.
Exactly.
But you can catch that up on our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So where did we leave off?
So we were talking about advocacy and about long-term care and, what the state is doing and what the feds are, that kind of historically.
But you want to jump into that messy stuff? Because it really is so messy.
It is messy. I mean, you're talking Medicaid cuts and you're talking, what's going to happen to Medicare in the future, because that funding is dwindling down.
But it's dwindling
Social
down
Security.
because there's so much freaking fraud.
Exactly.
I mean, how come we can't get our claws around this thing? And I mean, I'm not for public execution, but I am if you can catch someone stealing Medicare dollars.
Human beings.
Or Social Security dollars.
I mean, we've seen a lot of humans in our lives, and there are nefarious humans that are out there. And they like to hit the easy button, so it's like, let's go defraud somebody.
Yeah.
And why not? With the federal government, they've got billions that they have to serve. It's not just millions, the 350 million that are in this country, but you take those 350 million and, okay, maybe there's 50 million that are on a Medicare or on a Medicaid. Well, you got to keep talking
I think it's
to
60
those
or
people.
70, but you're close.
Sure, okay. I'm just extrapolating here.
Rounding down, not up.
Yeah, exactly. But you look at that, it's like you're not dealing with them just one time.
Right.
You have to deal with them many a time. So there's a lot of transactions that are happening.
100%. But you would think, and you and I are smart enough to know, while we may be a little old school, we know technology, we understand artificial intelligence and machine learning, and they've got to be scanning these documents and seeing the fact that, wow, there's like $2 million coming out of this one location for the month of April.
Right.
This doesn't make sense because they did 1.8 million last year.
Yeah, exactly.
There's
that, but then you also have the folks that maybe are on Medicaid, and it goes the other way, to where they don't have a family member advocating for them, and all of a sudden they get cut off. And it's like, well, because we haven't heard from you, we don't know if you're dead or alive, and next thing, or something happens and they fall through the cracks and they're gone off the Medicaid rolls. And that's disappointing because we should be able to catch those, and we should be able to catch the fraud and abuse.
It's interesting because when you look at the challenges in our country, and housing is right up there at the top.
Big time.
And food insecurity right behind it.
Sure.
And it affects our older adults at a much higher rate than really anybody else.
Oh, big time.
And,
yes.
That's the area that you are serving. And a lot of those people, need the support, especially as they age.
That's correct. They totally need the support. And so one thing we learned from COVID, especially on the skilled nursing facility side, is that putting somebody in a room and not letting them see other people, although that might be good to keep germs away from you and to not kill them, social inactivity is very difficult on the human psyche. And what do you do with somebody who is at home, they're being taken care of at home, and how do you have that social interaction, and how do you put that into play? And it can become difficult.
It was solitary confinement.
Yes.
You think about some of those really bad guys in these prisons and they're in these solitary confinements. That's what we did to the older adults.
Sure we did.
We said, you got to stay in these four walls and you can't go anywhere.
Yes, absolutely. Now, I can defend that from a skilled nursing side because once COVID got into a building, it could kill people.
Right.
So you have to have a balance, but we didn't even know what we were dealing with back then.
Sure.
You know, and didn't understand how to do infection control from a COVID standpoint. We didn't even know. I remember hearing news reports. They would come out and said COVID could last on countertops for weeks. And it's like, really? It's a virus. It's a germ. It needs a host. How can that be true?
Yeah,
you know?
right.
But you don't know how to kill it. So there's all of these things going on, and it became difficult, and it became exponentially more difficult when you looked into people's homes and when you tried to keep them at home and when you tried to do all these restrictions. Whereas if we would have taken my opinion, if we would have taken a broader approach to it and said, okay, let's look at what is really going on here and then not shut everything down. I mean,
Right.
you know, there were some states that just shut the whole economy down, and we did a little bit of that here in Arizona, but we had some decent people at the top that were really trying to work their way through this.
Good thing we didn't live in California.
Oh my gosh,
Yeah.
that would have been awful.
Oh, it would
Totally
be. And
awful.
and you know, I don't want to go down here, but I know you and I have talked about it.
Yeah,
Because of that, we have far more Californians that live here in Arizona.
absolutely.
And
yeah.
and they've driven our pricing for our homes and country clubs and automobiles and
You bet.
apartments, you name it. Everything is skyrocket because they brought all that money here.
So think about that for a sec, Bob. So you mentioned 6.8 million Arizonans, and by 2030, we should have over 8 million.
Yeah.
In fact, we're on that verge now, I would say, that people are
And
coming
the
in.
65-year-old population between now and 2030 is going to be up 41%.
Bingo. Exactly.
41%.
How are you going to pay for those services, number one? How are you going to keep those services going? And what kind of infrastructure are you going to have to make sure that the current services can be maintained? In some cases, you can't because the numbers aren't there.
And we can't balance our budget here in our state.
Right. So
I mean,
we're having troubles with that.
we talked about Sindai. I think this session's going to go past maybe the end of June. I mean, it's crazy.
That would be hard.
It would be hard.
Yeah.
All right, maybe middle of June.
There you go.
I'm being a little hyperbolic. Yeah, it's Friday.
yeah, you're throwing stuff out there,
Yeah,
but you got the numbers better than I do. So it's like, what the heck, you know?
Are you kidding me? I'm just BSing. I don't know what these numbers are. I don't even know what a Sindai is. But you know what? I just know it's a Latin term that they use to end a session.
Yes, it
Done.
means final.
Final.
Yes, or in Italian or in Latin, in finality or something like that. I don't know, but yeah, they got to use that term for sure. So I'm from Illinois, right? And our legislature, in their infinite wisdom, would come up to June 30th. Fiscal year starts July 1st, and it would tick 1 minute to midnight. So you know what they'd do? They'd stop time. Literally, they had an official clock in the House and the Senate, and they would stop it at 1 minute to 12. And then they'd go until about July 10th, July 14th, July 15th to come up with a budget.
No way.
It's like because the Constitution says you have to have a budget by July 1st. Well, not if the clock doesn't say it's July 1st. That's government for you.
It kind of reminds me of a business that I was running. I used to have this team, my billing team, that used to leave early.
Yep.
And I'm going back. You and I are a little old school, so I'm going back almost 30 years.
I can't wait to hear this.
I went in the billing room, and I moved the clock.
Did you really?
Oh yeah.
Did they catch on?
You know what? I think they caught on later, but you know what? I got tired of them skipping out before 5 o'clock.
Right.
So you know,
Some of them are listening now, and they're going, "I knew it! I knew somebody was messing with the clock."
But it's funny that that's what they do in Illinois.
Yeah.
So a big part of the work you do is this advocacy work, and you're advocating so that one, we're protecting older adults, but we don't want too onerous regulations. You have enough regulations that you have to deal with, both federally and state. And while some of it is well intended, there are unintended consequences to everything that one does.
Yeah, exactly. So they say that nursing homes, first off, we're regulated by the feds and we're regulated by the state. and they say there are more nursing home regulations than the regulations on a nuclear energy program.
Are there really?
That's what they say.
Who
I can show
who is
you
they?
that. I have no idea. I'd like to meet them sometime. But I know for a fact that if you look at the regulations, I have one of the old books in my office, that it's almost 2 feet thick.
Wow.
You know, and
That's why you had to get your eyes done.
exactly.
And I'm telling
so
you
I can
that-
see
exactly
all those regulations. So it's not as easy. For instance, you want everybody to, let's take memory care, for instance.
Mm-hmm.
House Bill 2764 was passed last year. It took months and months and months of discussions to try and figure
With the
out.
stakeholders.
With the stakeholders.
That's
yes.
important to bring all the stakeholders together.
Correct, yes. And kudos to Representative Dunn, who is now Senator Dunn, out of west part of he's got a huge district, goes all the way down to Yuma. He's from Yuma. He did a great job of bringing all these stakeholders together and us not killing each other. So because you have to go in and you have to try and define what memory care means, and then you have to try and figure out how to put that into language that's understandable for everybody, and then keep in mind what your goal is. And coming out of that, and we're going to see it here at the end of June, we're going to have memory care regulations that kick in.
And do you think it turned out to be a good bill?
No, but that's the art of compromise.
And
nobody's happy.
And that's the thing. I talk about this all the time, and I had this discussion with my chief of staff the other day, and that is, I learned this from my father, and our parents had great wisdom, great
did.
sayings. We were given quotes
Big
before
time.
by some people we won't re-mention, but one of the things my father said is when you're negotiating with somebody and you get everything that you want, it's a bad deal.
Right.
It's a bad deal.
They're going to want something back from you.
You have to give a little something to get something.
That's right.
And in order to get a good deal, both sides have to be able to compromise.
Exactly.
And,
totally agree.
And I know that you get a bill, and we'll get back to this in the second half, but it all boils down to the ruals that follow the bill.
Oh,
so,
yeah.
So you
it's
can
not
get a bill
over.
for it until the rules come out.
We'll talk Yogi Berraism.
We'll talk more about it when we come back. It's halftime here at Health Futures. We got Dave Voepel in the house. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you, and we are in our second half here. And if this is the first time you're tuning in right now, I got Dave Voepel here in the studio with me. He's the CEO at the Arizona Healthcare Association. And if you missed that entire first half, you can go up to our website at cypresshomecare.com, click on the media button right below its radio show. You'll catch this one and many more. I still can't believe it's been 3 years.
I know it. I can't either.
We can't wait that long.
Yeah.
I
we
mean,
should do it more often.
we got some good chemistry going here.
You got the podcast and everything.
Yeah.
It's like, holy cow.
And we were talking advocacy. I mean,
Right.
do we want to go down that road anymore? But I do want to.
Such a struggle.
I do want to say this. I mean, bringing all the stakeholders together is really important.
Right.
And it's really important to make sure that everyone is focused on the mission.
Yes.
And I mean, I can't. I know I'm recapping a little bit our first half, but I can't believe how onerous the regulations are for you guys.
Correct.
More onerous than a nuclear
Power
facility.
plant.
Power
Right.
plant.
Isn't
Yeah.
that nuts?
It is nuts.
Yeah. But you got to remember, why are those put into place? And it's
Because they're bad
because of-
actors.
They're bad actors.
There are bad actors
Yeah.
out there, and your trade association exists today to lift everybody up. I
Correct.
won't use that metaphor, but
Right.
to lift everybody up, because that's why they belong to the trade association. They learn best practices. So I want to dive a little bit deeper into what you guys do, because it's more than just advocacy.
Yeah, no, it's. I think one of the big things. Granted, we have advocacy. We try and be collaborative and good partners with the state to try and figure out solutions. That's our big thing. Is that when our members have an issue, we couple that together with, okay, what's the solution on this, and then let's try and fix it. And that's an everyday process. But then the best practices, because there are some very innovative folks out there that do such an awesome job. I can point you to all areas of the state and show you a skilled nursing facility that is doing an amazing job in various areas. Now, there are also others that aren't doing such a good job, or they're low on staffing, or they don't have good leadership. They don't have various things. But that's the other reason why we exist, to take those best practices to get everybody together, which is what we're going to be doing June 16th through 18th. How's that for a shameless plug?
No, please, give that shameless plug. What's happening on June 16th to the 18th?
That's our annual convention and trade show.
And where's that at?
This year we're going to be out at the Renaissance Glendale, so next to the State Farm Center.
Yeah.
We're moving over there from downtown, and we've got over 400 people registered for it right now, and the expo is sold out.
It's a great facility.
It's a great facility. They
Well,
fixed it all
I
up
envision you guys growing so big, because we were talking about what the population is going to look like in 2030. You'll probably have one in 2030 at the Cardinal Stadium.
That would be awesome. That would be so much fun. I'd love to have a giant party for everybody. Come on out. We'll have some fun.
No, but that's a great location.
It is.
And for anyone that's in the business or interested in that business, how do they learn about the event that's coming up?
Go straight to azhca.org, and they can see
azhca.org. There you go.
And all the way over to the right, top right, is education.
Wow.
And you can plug in the
Expedition Navigating Quality.
Exactly.
Oh, I like the. Did AI do this?
So no, not at all.
It's so impressive.
We're going to have all sorts of fun stuff in there. So my predecessor, Kathleen Collins-Pagels, I'll have to give her a plug, because
I love
Kathleen.
her. Oh yeah, Kathleen amazing. Is she going to be there?
So I don't know. Trying to get her out to these things is she's been there, done that.
She's awesome though. Big shout out to Kathleen.
She coined a term called edutainment. So you have to, if you're going to keep people in their seats, or if you're going to keep people around, you're going to need to educate them, and you're going to need to entertain them, and then you're going to have to provide some decent food,
right?
Because people have to eat,
right?
So we do that. We're going to have a rock climbing wall for people to go on. We're going to have an old Jeep sitting in there. We're going to have just some fun stuff for people to do, and then they get to go through their sessions and learn some best practices, learn from some of the authorities, whether it's Access or ADHS or other folks that learn what's going on, or how to interpret some of these massive regulations that we have happening.
Well, and you know what, I think what's really important, and I think this is why we are like the redheaded stepchild, and people don't really pay attention to us. Mm-hmm. Aging isn't sexy.
No.
Not sexy at all.
No. Nursing home's a bad word.
Yeah, and it really shouldn't be.
Right, it shouldn't be.
And you know what? We're all going down this journey together.
Right.
And you know what? We need to make sure that we have these safety nets out there and ways for people to be safe and to be protected and be able to give them the best that they can get at the end of their lives.
The right caregivers, the right CNAs, the right RNs, the administrators, people that need to be in the business, those folks that do such a great job.
So you see a lot of innovation in your space.
Yes.
Tell me, and again, it's those really good guys, those progressive guys that are leaning in and they're adopting a lot of the stuff. And I know what's going on in the home care space, but tell me some of the really cool stuff that's happening out there that you're seeing.
So when you turn 60, the idea of you falling, all right, is the propensity is you're probably going to fall at least once a year. Okay, that's about the average.
Oh yeah.
Okay, and define fall however you want to define it. Well, in a nursing home or in a skilled nursing facility or an assisted living community, we have to watch out for falls, because obviously you can't have tripping hazards and all that other good kind of stuff. But what happens to someone when they're disoriented because it's 2:00 in the morning and they have to go to the bathroom? They'll fall. They lose their balance.
Right. What happens to someone taking lots of medications and drinks alcohol?
Yeah, exactly.
They fall.
They will fall. So what do we do about that? Because that, for a skilled nursing facility, it's their responsibility to make sure that you don't fall.
Mm-hmm.
And one of the ideas comes from a company called Helpany. You've heard of them.
They've been on my show.
They've been on your show.
Yeah, Sandro.
Sandro has he has some amazing technology.
He's crushing it.
It's not a camera.
No.
So get that part, get that HIPAA stuff and that privacy piece out of the way. It's radar based, it's AI based, and so that technology is absolutely amazing.
We need to tell Sandra we're talking about him.
Yeah, we do.
I mean, seriously,
for sure.
This is Switzerland technology. I mean, come on, Switzerland gave us chocolate.
Yeah.
They gave us a Swiss Army knife.
Exactly.
And they gave us Helpany.
They did.
It's all good.
They do.
And they're helping anyone. And seriously, I mean, the radar piece, and I love this, and I want you to know, Dave, first time I met him, I'm like, let's roll.
Yeah.
Let's rock.
Yeah.
And he went back to Switzerland, and his board gave him specific direction. They want to focus in on the communities first.
Sure.
Before they go into the home.
Absolutely.
And I think it's smart. And I was like, okay, I'll stay on the sideline. I'll wait.
Yeah.
Don't
grow too fast.
No.
Make sure you got a good product. And they're doing that.
But the data is overwhelming.
It is.
That they are producing, and I'm reading it. He's giving updates every week.
It's amazing.
It's fascinating, and to be able to provide that data to the families and the person that needs care.
Well, that's the kicker.
Yeah.
So with any of these programs, and there's a lot of good technology that's out there in this regard. Some is camera-based, some is sound-based. A lot of it uses AI, that type of thing. None of those can stop somebody from falling.
Right.
But what they can do is they can be predictive, and they can tell the staff, hey, this person is moving around. They're probably going to get up here in the next couple of minutes because like last night, the night before, and the night before, humans are creatures of nature. And so get in there to take care, help the person get to the bathroom.
Right.
So that will stop a fall right then and there.
Yeah.
But there's no silver bullet to that. People are going to fall.
And I'm going to leave this with our listeners and with you. Mm-hmm. You talked about the listening one. So we use a company called Sensi.
Yes, Sensi's a great company.
It's a great company, and I'm an advisor to them, and I love what they do.
Yep.
And the one thing that we have discovered, people are falling a lot more than we knew.
Yes, that's the other thing.
And doesn't mean when they fall, they're getting hurt. But they are falling, and one of those times can be catastrophic.
Yes, big time.
We'll leave it at that. We're down 3 segments. We got one more to go. What are we going to talk about closing?
Well, I don't know. Let's talk about something fun.
You're going to the D-backs.
So I am. Saturday night.
Yeah.
Yeah, you're going someplace better.
Yeah, I am.
Oh, my gosh.
Go
We'll
on.
talk about that.
Yeah, we could talk about that, too.
Yeah, maybe you should bring some samples back.
I could do that. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Dave Voepel here in the studio with me. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our 4th segment. I got Dave Voepel here in the studio with me.
Flies by.
It does.
Gosh, I've said that 6 times, I think.
That's all right. CEO of Arizona Healthcare Association. And if you missed any of those first 3 segments, go up to our website, cypresshomecare.com. Click on the media button right below its radio show. So, all right, we're here in our 4th segment. We talked a lot about innovation in that 3rd segment.
Sure.
And it's such a small world. I mean, we
Totally.
gave a big shout out to Sandro and Helpany and with the work that they're doing. Anything else you're saying that, falls are, and I want our listeners to know this, more than 50% of the 65-year-olds that end up in the ER are ending up in the ER either for a fall or medication error.
Correct.
And
isn't that amazing?
It is. It's absolutely amazing. And, it's amazing that everyone's on so many medications.
Right.
I mean, that's we got to stop all those drugs that people are taking.
Yep.
But nevertheless, what else are you seeing in the communities?
So there are a lot of staffing has always been a big issue. It will always be a big issue,
Yes,
especially in skilled nursing facilities. And there are some leaders in the staffing. I was in Douglas, Arizona about 1.5 years, 2 years ago. So we were just coming out of COVID, And Douglas has a nursing home there. It's Haven of Douglas. Give them a little shout out, even though they won't hear us down in Douglas.
Yeah, but how many nursing homes do they have there? That might be the only one.
It's the only one.
Yeah, it's a small town.
It's a small town. It's right there on the border.
Right.
And you would think, okay, they're probably struggling. They're probably not. I get out of my car and I hear this rooster crowing.
Oh, very cool.
I'm like, oh, what's that? That's interesting. What are we doing? And I walk into the building, and it's like there's a party going on, Bob. You wouldn't believe it. They have the administrator, Adam, comes up. He gives me a big hug. Dave, so great to see you. They are having this is 10 o'clock in the morning. And he's 100% staffed. At that time, he's 100% staffed. And he was one bed shy of being full.
Right.
And I'm like, how are you doing this? You know how he did it? You know how he continues to do it? Leadership and culture.
Yeah.
Those two things alone bring people in, and they bring people together.
Well, leadership matters.
It matters so much.
Everybody is in sync with whoever that leader is.
Exactly.
And if that leader is a horrible leader, then the rest of them really suck too.
And the rooster crowing, it's because they had these award-winning chickens that they kept in the courtyard that the residents would come out and feed and take care of, and then they'd take them to the county fair, and they'd win awards with these doggone things.
Wow.
And it was so cool to see. Everybody's totally engaged, and it was like family taking care of family, and it was pretty awesome. So that type of, it's not technology, it's culture, and it's leadership, and it's learning, and it's trying to get the job done the best way you know how.
And are people able to get this out of the Arizona Healthcare Association? Are you able to, I would imagine June 16th through the 18th, there's some really great presenters that are talking about just this.
So you've seen the movie Unstoppable?
I've not.
Okay.
I'm
Anthony
sorry.
Robles?
I know who he is, yeah.
Yes, the one-legged champion wrestler. He will be a keynote speaker, one of our four keynote speakers.
Wow.
Yes. So amazing. He is something else.
Inspiring.
Very inspiring. So he's going to come up and talk to us about what he went through and some of his trials and tribulations. I can only imagine.
Right.
The movie is unbelievable. I mean, it's unstoppable.
Yeah.
And such an amazing deal.
He's the hiker, right?
So
he was the wrestler. He was the
He
wrestler.
was the wrestler.
Yes. I
With
remember.
one leg.
Yeah.
It's amazing.
Yeah.
We have Mark Parkinson, who was former governor of Kansas, who led our national organization for 14 years. He's coming back to talk to us about listening and how to thank people and how to do. And you think, okay, anybody can listen, anybody can thank. And it's like, no. Let's really take some time here and really thank the people that need to be thanked, because sometimes you have to be reminded of those things.
100%.
So it's
sad that you have to be reminded, but we're talking about a generation that didn't grow up in the same generation you and I did.
Yeah, send a text or something like that. It's like, that doesn't always work.
Yeah,
it's like,
right.
Come on, let's get a little more personal here,
100%.
So, yeah. So there's all sorts of innovations going on, and it's people automatically gravitate to the technology part, and it's not necessarily technology in our business, because not everybody can afford the Helpany technology or some of the other big technology that's out there. I think soon, one of these days, coming probably quicker more than anything, we're going to see more robotics, more help along those lines with robots. I think that'll be kind of fun.
I've seen some of that stuff.
Yeah, I mean, we've already got Siri and we've already got Alexa.
No, but I've seen it in your communities. I've seen the robots that are working in the kitchens and stuff like that, and bringing it out to the tables and stuff. It
Exactly.
fascinates me. I mean, they're running off like QR codes.
Yes, and it's like, how do you know where the heck you're going?
Yeah, and
like
it shows up to the table, and you got your meal. I mean,
it's pretty cool.
It is fascinating.
I think we're going to see a lot more of that. That's coming pretty soon. Again, it comes down to money, reimbursement. There's not a lot of dollars that are thrown at a lot of these buildings, and they have to make their own way through things. And there's not too much private pay out there either, as you know. So
well, you talk about dollars, but I talk about margins.
Sure.
The margins are really small.
Oh, they're so thin.
And it's really hard to reinvest in your building and do a lot of things.
So here's something to think about. For a skilled nursing facility that has a Medicaid, all-tax EPD, elderly or physically disabled person, so that the state is paying for through the Medicaid program, skilled nursing is under by $32.52 per patient day. That means if it costs you $200 to take care of that person, you're only getting reimbursed that $300 minus the, or $200 minus that $32.50,
Yeah.
$160 or $167.50.
Yeah,
Right?
$167.50.
Yes.
So you're already at a deficit.
You're already at a deficit.
Wow.
So how do you deal with that?
I don't know.
So, and if you have a 60%, so if you have a 100-bed home and 60% are Medicaid, all of those are deficit spending right off the bat. Okay? So you have to have a good case mix. That's the only way to make it work. You have to have Medicare Advantage.
Or you have to have enough people marching down on Capitol. And that's the hardest thing. You can't do what the teachers did.
No.
When the teachers sent 50,000 people to the Capitol,
Right.
you can get people's attention, but
That's right.
you can't get 50,000 older adults to
No,
go.
they
Can't get out of bed.
No, they can't get out of bed. And number one, and you can't send caregivers down there because you need them taking care of the older adults.
Exactly.
So we did this year a new thing down at the Capitol. We did weekly lobby days. So for 6 weeks, from the end of January to the 1st of April, we did a lobby day a week.
Oh, I like that.
And we brought people in to talk to their legislators. And so owners, operators, RNs,
patients still?
LPNs, no residents.
No residents, okay.
Because it's too difficult to do.
That's true.
And we've got these folks coming in to talk specifically to their legislators about what this means to be underfunded.
Wow.
Now, we'll see if it makes a difference in this year's budget, which remains to be seen.
I got my fingers crossed.
I do too.
We're getting ready to wind down. So I love that edutainment. Wow.
Yeah. You see, I love that.
Yes, I really get big props to Kathleen.
I will, big time.
Big props. So we also have this Arizona Healthcare Association Convention and Expo on June 18th to the 16th to the 18th at the Renaissance Glendale Hotel.
It's going to be fun.
It should be a lot of fun.
It's going to be a blast, yeah.
And to learn more, just go to azhca.org.
We need to get you out to be a speaker.
Well, I'd like to.
Next year, our theme is going to be denim and diamonds.
Ooh.
So it's going to be kind of a cowboy theme.
Yeah.
So
my wife's all over the diamonds.
There
I'll be wearing the denim.
Yeah.
So as we get ready to close, is there a lasting message you want to leave our listeners, or is there a question I haven't asked that you wanted me to ask?
Well, that right there is a great question. You know, one of the things that families go through, and I'm sure you see this a lot, is that they don't want to send folks to a nursing home because and it promotes family guilt. And we see a lot of family guilt, or they tend to drop people off, their elderly mom and dad, grandma and grandpa off, and then they don't see them until they hear from them maybe 6 months down the road, and they think that there's a problem. I would say one thing is make sure you call the facility, and before you even put mom and dad or grandma and grandpa in a facility, go check it out first. It might not be the right place for your parents.
100%. No, I like that.
So,
get eyes on it.
Yes, absolutely. Get nose on it.
Get nose on it too. Yeah.
Smell it. If it doesn't smell right, walk out.
Yeah.
So,
if you don't get that ammonia smell, make
Yes.
sure you don't get that.
Yeah, big time.
Dave Voepel, it's so great to have you in the studio.
Bob, thanks for having me.
We're not going to wait
Appreciate
3
it.
years, and I'd like to next June.
Yes.
Let's talk about having me come
Be
and
fun.
speak.
Yeah.
You're listening to How Future's Taking Stock in You. I'm your host, Bob Roth. We're saying goodbye. We'll be back next Friday. Make it a
Bob,
great
for
day.
having
Have
me.
a great weekend. And have fun at the Diamondbacks on Saturday.
Yeah, you have fun west.
You bet.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.